I'm with International Medical Advisory Board member Dr. Burkhard Dick, one of the European representatives of IMAB. Burkhard, one of the fascinating things about the board of IMAB is the way its membership spans the continents. You have a common goal, but everyone has a different story to tell.
That's right. It's a great pleasure for me to be a part of the International Medical Advisory Board. I myself come from an academic background, so I'm a medical director and chairman of a university eye hospital in Bochum, Germany. And we have different objects to cover. One is, for example, education. The other is clinical care. And another thing is scientific work. And in terms of scientific work, for example, we have a clinical trial center where we cover 15 to 18 active trials, clinical trials. And we have an experimental eye institute where we are doing basic research. And of course we have clinical care. That means we have about 4,000 cataracts, about 1,000 pars plana vitrectomies, and I personally have to cover everything.
Most IMAB members regularly publish papers and make presentations across the world. You actually must be pretty near the top of that league.
Could be, but at least I try hard to become into that league, if I'm not already there. Well, I published more than, let's say, 300 articles in peer-reviewed journals like ophthalmology and investigative, so the top journals I'm looking at, and the content is more or less about everything in ophthalmology, but also in cataract refractive surgery, where we focus on new innovative things as well as prospective randomized comparative trials, where there is a lot of effort behind, and I think it's important to share this with the ophthalmic community.
So tell me more about Burkhard Dick, the person.
Well, I was born in Brake, in northern part of Germany, and where I went to school, for example, and then went to university for medicine, to study medicine, both dentistry as well as ophthalmic care. So the head was my major focus, so to say. And then I was started as an ophthalmologist in the University Eye Hospital in Gießen, went over as a head physician to the University Eye Hospital in Mainz, or in Germany. And then I got the appointment to be the director and chairman of the University Eye Hospital in Bochum, where I live. So then during that time, my girlfriend is my partner for 24 years now. She's a judge at the Supreme Court in Frankfurt, and so I behave myself, I have to, and we are really enjoying time because it's a good mixture, legal as well as medicine to share.
And you're a bit of a fan of football?
Oh yes, I am really a great fan of Borussia Dortmund. Dortmund is the place where our house is, and we look on the stadium and walk there as much as we can to the home games, sometimes also to the to other games, but really I'm a supporter of Dortmund.
And you like sport?
Yes, I'm very keen on sport, everything, skiing, tennis for example, but also gym and jogging and other sports I like to watch and do myself.
Now the IMAB board comprises some quite different personalities, and it's one reason why it works so well. Coming from a more academic background, how have you found it?
To be honest, I was contacted by Steve Schallhorn, who made me aware of that, and he's a highly respected person, and I really adore him also with his approach to refractive surgery, and he's an extremely bright colleague. And he contacted me, and when he showed me how the Optical Express is working, it really convinced me, because they have a really scientific, clear approach in how to analyze patients and examine patients and select patients in terms of suitability. It's clearly defined what how they are operated and how they are followed, and everything is analyzed, and so they try to provide the best patient care, also from a clinical point of view as well as from an academic point of view. And this sounds to me like a German approach, but as a matter of fact the origin is in the UK.
So how would you describe your personal input to IMAB? What part of the jigsaw do you provide?
Well, I'm on one side I'm the medical director in Germany, so I advise Optical Express in terms of their centers and the patient care. Also, of course, I analyze the data for Germany, and more important also, if there is something, they have a very great complex case management. Rarely patients go into it, but they are followed, they are not lost. And one of this part is then to take care of these patients and maybe treat them if necessary.
I'd like you to look a little bit into the future now, if you will, Burkhard, and tell me what you see for laser eye surgery and for natural lens replacement.
Well, laser vision correction is already on a very high level. It is safe and very effective. Complications are extremely rare, and everything has been investigated over decades now already. So we have a long-term tracks with laser vision correction, and we can do a lot of good things with laser vision correction, treating presbyopia, treating all kinds of emmetropias. So there is, I wouldn't expect big changes in laser vision correction in the future. Maybe small and tiny improvements. Still, as usual, there's always room for improvement, but on a very, very, very high level. For lens replacement and intraocular surgery, I would say it is also extremely safe, because cataract surgery, for example, is a standard procedure, but new intraocular lenses are coming up, new modalities are showing up, and it's more or less now, with this great diversity we have, a selection which lens for which patients and his demands. And with the demography behind, that means I'm a baby boomer, so I will also develop cataracts. It will become more often an option, even for just preventing cataracts and just replacing the natural lens, to just give the patient more options back. Especially true for presbyopia, for example. So there are so many things coming up and already available that I would say it's a good option to offer for patients. And Optical Express itself will always be ahead because of the perfect guidance they have, and they are looking at great innovations. Looking at that means they are evaluating this from different aspects and make this decision in favor of the patient. That means not every innovation is good, but they are taking care that they have that implemented already, so that it's not a normal treatment, but a higher level of patient care.
So Burkhard, what are your personal goals for the future?
Well, I'm at the top of my career. To be a chairman in Germany at a university eye hospital is the highest position you can achieve. So I'm now looking more to expand and being a key opinion leader in ophthalmic surgery and care. So I try to educate more now, like education of assistants or my head physicians in terms of ophthalmic care, but also ophthalmic surgery, of course, to bring them to a even greater level of patient care, and of course also to be more involved with the work with Optical Express. It's a great reward, and it's reflecting myself, what I'm doing now, and well, finally maybe that Borussia Dortmund wins the championship. That could be second.
Burkhard Dick, thank you.
My pleasure.